This meeting is being recorded.
Hello, good afternoon, man, and all my friends. On this occasion, I will make a presentation. But first, let me introduce myself. My name is Renata Ria Josephine Panjaitan from Class D. I come from Udayana University, Veterinary Medicine. Today, I will do a presentation that discusses a disease called Septichaemia Epizootica. The purpose of my presentation is to introduce this disease and invite everyone to prevent this disease. Alright, I will start my presentation. First, I will explain about what is Septichaemia Epizootica. Septichaemia Epizootica, or snoring disease, is an infectious bacterial disease that affects livestock such as buffaloes, cattle, pigs, goats, sheep, deer, and horses. Septichaemia epizootica caused by Pasteurella multocida with serotype 6b is widespread in Asia and Europe, while serotype 6a affects animals in Africa. The disease occurs mostly during the rainy season. Affected animals show clinical signs such as high fever and lethargy. Okay, next, I will explain about symptoms of Septichaemia epizootica disease. First, fever. An elevated body temperature is common symptoms septicaemia in animals. 2. Depression and weakness. Infected animal may appear lethargic, depressed, and weak. 3. Loss the appetite. Animal with septicaemia may show a decrease in appetite. 4. Increased heart rate. Septicaemia can lead to an increased heart rate as the body tries to cope with the infection. 5. Difficulty breathing. Respiratory distress of difficulty breathing may occur in several cases. And the last one is discoloration of mucous membrane. Mucous membrane, such as the gums or inner eyelids, may show signs of abnormal coloration, such as paleness or blue stain. Okay, next, this is a photo. This is a photo of animal who get a Septichaemia epizootica. Okay, next, I will explain about factors that cause Septichaemia epizootica. 1. Pasteurella multocida bacteria. This infection is caused by Pasteurella multocida bacteria, which can enter the animal's body through wounds or damaged mucous membrane. 2. Wounds or injuries. Animals with wounds or injuries have a higher risk of infection, as bacteria can easily enter the body through the wound. 3. Unhealthy environmental condition. The cleanliness of an animal's environment is essential to prevent the spread of disease. A dirty or unhygienic environment can increase the risk of infection. And number 4 is stress. Overly stressed animals have weakened immune system, making them susceptible to infection. Stress factor may include environmental change, decisive transport, or a change in diet. And the last one is contact with infected animal. Disease spread can occur through direct contact with an infected animal or through intermediaries such as insect vector. Okay, now, how Septichaemia epizootica spread? Septichaemia epizootica spread with direct contact with infected animal. Infected animal can transmit the bacteria to other animals through direct contact, such as sharing feed, water, or resting areas. Licking or touching each other between infected and uninfected animal can be also a way of transmission. Number 2. Environmental contamination. Pasteurella multocida bacteria can survive in the environment, especially in damp places. Environmental contamination, including feed and drinking water, can be a source of transmission if healthy animals consume it. And the last one is insect factor. Insects such as flies can act as factor of transmission. Bacteria can attach to the insect's body and be transmitted to healthy animals when the insect causes or infects them. Now, I will explain about treatment in Septichaemia Epizootica. First, give antibiotics. Antibiotics are key component. Nah, 2. Supportive care. Animals with septicemia often require supportive care to help them through the severity of the condition, which includes intravenous fluid administration to address dehydration, supplemental nutrition, and body temperature management. 3. Wound and injury treatment. If the disease is associated with a wound or injury, direct treatment of the injury area will also be required. Number 4. Animal isolation. If an infected animal should be isolated to prevent transmission to other animals in the group or farm. This also helps to reduce the risk of disease spread. And the last is stress management. Okay, implement good management practice to reduce stress in animal. Calm animal tends to have a better immune response to infection. Now the last one, I will explain how is Septichaemia Epizootica prevented. First, we can give vaccination. Administering an effective vaccine is a key preventative measure. Vaccine designed against the bacterium Pasteurella mutocida can help boost an animal's immunity to the disease. Number 2, we can keep the animal's cats feeding, drinking, areas clean. And number 3, isolate infected animal. Isolate animal that appear sick or show symptoms of Septichaemia epizootica. Disease can prevent transmission of the infection to other animals in the group of or farm. And stress management. Animals are more susceptible to infection. Good management practice such as providing good feed, ensuring adequate water, and avoiding stressful situations. And the last, we can perform routine health monitoring on farm animals. Okay, look out for behavioral change, decreased production, or other clinical signs that might indicate disease. Okay, conclusion. Septichaemia epizootica is a disease animal such as cattle and buffalo with symptoms of high fever, rapid heartbeat, and low blood pressure. We must be aware of this disease and take precautions that such as vaccinating and checking routine animal health, as well as isolating animals with indication of Septichaemia epizootica and providing treatment such as antibiotics. This treatment can be given by veterinarian. Okay, in closing, I would like to encourage of all of you who see your animal, such as cattle, experiencing the symptoms that I have mentioned, to contact your veterinarian immediately for better treatment. I would like to thank you to ma'am and all my friends for watching my presentation so well. Thank you so much and bye bye.